Well, late September, early October, I started getting very sharp stomach pains, which I ignored initially because, you get upset stomachs. But it didn't go away, so I went to the urgent care center in Santa Clara. They did a CAT scan and saw that I had a mass on my colon and a small lesion on my liver. So they recommended me to a Dr. Wiseman, who is a gastroenterologist, if I'm saying that correctly. He did a colonoscopy and he determined that my mass on my colon was cancerous, as was a small lesion on my liver. And then he recommended me to Dr. Singhal here at El Camino at the medical center, at the Cancer Medical Center. She talked to me about what the procedure was going to be to remove the mass from the colon. That was going to be the first step. And she said it wouldn't be too invasive, and it wasn't. And that operation was done Monday of Thanksgiving week. And I was in the hospital for about 10 days because I developed a virus about halfway through, so I couldn't go home right away. But she removed it. She said the operation was very successful. And what impressed me about her, in addition to her being very, very competent, of course, is that after my operation, she called my sister in Boston because she knew she was concerned. And while I was in recovery, my sister knew more about the operation than I did. But she put her at ease and even recommended that she come out in a couple of weeks. So my sister was very, very grateful that she got that call from Dr. Singhal. And obviously I am too. They make you feel very much at ease. First of all, they make your when you've got the cancer not to be so frightening. I mean, everybody is worried about that, but they are so very positive that they're going to cure it, not just put into remission. And so they're very positive about that, and they just go out of their way to make you feel at ease. I know when I was in the hospital recovering, I was one of the first patients because the hospital just opened that week. And they were all just very well too, but the doctors came in every day. Again, they made everything very, very comfortable, though I was in for 10 days, so I have to admit it became very tiring. I now know what sick and tired means. It means a hospital stay. But at the medical center, at the cancer center now, Dr. Dormandy is my oncologist. And I'm getting chemotherapy every other week, every other Tuesday, and then I'm on medical tablets. He said it's a treatment that's going to be very mild. He told me the side effects, but I've been without them. I'm not going to lose my hair. Again, the people there are very, very gracious and very accommodating. Always around, very like a mother hen over the chicks. So I'm very comfortable with what's going on. I'm having a PET scan done tomorrow after only 4 treatments. He had said it might last 5 or 6 months, but he's kind of thinking that because of my blood result tests and what I've been experiencing, that maybe things are going along faster. So we'll find out tomorrow just where I stand. But no, again, they put you at ease. It's you're still concerned, but they're very positive that this is a beatable thing, and you can't help but feel positive yourself because of it. I have been very fortunate to have had some tremendous physicians and nurses. They're very much impressed with the treatment and the way they deal with you. I mean, it's they put you at ease. It's the best I can say. I mean, I'm very comfortable whenever I go into an office. I get a diagnosis. When I hear about the treatment, I have complete confidence that what they're saying is what I should be doing. So I have no problems at all. Yep, I'm very happy with the people that I've been associated with.